Hi, everyone. Good evening. And it's a good morning somewhere in the world. It's good afternoon somewhere in the world. I just wanted to review the comments that people made on Facebook regarding the tributes that I did on Chadwick Boseman, who died of colorectal cancer, which was stage 3. He died last week on a Friday, and he died at the age of 43 when nobody knew that he had colon cancer. So I just want to share the message that really came from my heart, from the bottom of my heart. When I heard of the death, I was livid actually. I was disappointed. I wasn't surprised because I have seen 15-year-olds, 12-year-olds die of colorectal cancer. And I knew what the problem was. As soon as I read it, I said the guidelines must change. The colon cancer guidelines has to change. We are told that colon cancer must be screened at the age of 50. It's already too late. I think we're going to be screening a lot of dead bodies. We will lose our community. I want to read something that I wrote on my Facebook page that I want to share with you so you can think about it. And maybe when you think about what I'm writing, then you can share what you think is your take. And I'm going to read some of the comments from my followers on Facebook who really went all out and started talking about their experiences with colon cancer. And I think we really need to start talking. This silence is really killing us. We are not talking about abuse. We are not talking about suicide. We are not talking about cancer. We're not talking about, even about guidelines that are killing us. It's about time that we stand up and we start doing something about the challenges we see, about the things we see. In New York, they say if you see something, you must say something. You cannot see something and keep quiet. I'm not willing to keep quiet. There are challenges that we need to face. When I heard of the death, I started emailing some of my professors that I work with on the research, and I asked them, what is your take on these guidelines that tells us that a 75-year-old should not be screened for colon cancer? If you're 75 years old, it doesn't matter how healthy you are, it doesn't matter if you run marathons. I know a 90-year-old who was used to run at 90 years old. So they are younger. People are not as old as they used to be. People are not as frail as they used to be considered to be. And younger people are not as young as they were considered to be. They are not as unexposed to radiation as they used to be in the past. So the guidelines are behind. I find that us as doctors are so behind from the community. The community is facing a lot of things that are opposing what we see in the clinic. I'll make an example. When I started in 2003 to speak about cancer and going and advocating and asking departments to join and partner with me in raising an awareness of cervical cancer, breast cancer in the rural community. This was my community in Guanyuso in South Africa through a nonprofit that I started called Sinumusa Notando. I was laughed at and I was told something is wrong with me to think that Black communities are dying of cancer. And I followed a lot of cancer patients who were presenting with symptoms and were being sent back from the clinic. I decided it's about time that we do something. And each time I requested support from like organization like cancer at that time, that was 2003, I was told we do not go to Black communities because Black people don't get cancer. So there was this notion that Black people don't get cancer, and this is the research that was being publicized, and the same research is the one that is affecting the screening in the community. That's why through research we find that only 50 years old patients should be screened. for colon cancer. And we used to have theories and studies telling us 40 years old should be screened for cervical cancer, and has changed over time. We've seen the changes taking place on cervical cancer. You can screen it as early as 21 years old. It depends on each country because countries are completely different on how they act, on how they behave. But I just want to read something that I wrote from my heart. I'm going to read it because it was coming from my heart, and I was just pouring my heart out of the frustration that I was feeling as a medical doctor trying to help the cancer patients and going to the rural communities and telling people, come, let's screen. And then when people come to screen, we doctors send them back. I spoke also of me having a breast lump, and I was told I was 35 years old, and I was told I cannot be screened because I'm too young. And but because I know how to motivate, I motivated for myself, and it was done. So imagine someone who doesn't know how to motivate for themselves, they will not be screened. I'm going to read some of the comments. One of the lady who has been diagnosed also, who has felt the lumps, but she cannot be screened. I'm going to read her comment. She says, her name is Oli Sile. Thank you, Oli, for this comment, and I appreciate it on my Facebook page. She's my Facebook friend. She said, I'm also waiting to turn 40 years to be checked for mammogram. I have a lump on my right breast. I called Margate Hospital, which is in Port Shepstone in Durban in South Africa. I called Margate Hospital for an appointment only to be asked, how old am I? And they said, sorry, we can only screen you once you are 40 years old. I was numb to think I should be 40 years to be able to do a mammogram. Do you understand that we are now treating the age and no longer treating people? We are now screening the age and no longer screening the patients and the population and the community. We understand the challenges of over screening people with the negative. In the negative window. I understand that, but there are certain circumstances that we should take into play. She has a lump. Then you're going to ask me, what's her family history, right? That's what doctors are going to ask. What is her family history? But how do we know the family history of the Black community? How do I know my family history when my grandmother never used to go to the hospital because it was illegal for my grandmother to be in the towns where oncology units are based, where screening equipment is available? In my village, there's no screening done. There's only cervical cancer and palpation. There are no mammogram. So how do you expect Black people to know the family history? Let's start there. We are saying family history. Family history is when you find out in your family who died of what disease. How are we going to know? We were not allowed in the hospitals because of apartheid. We were not allowed because of racism. So because we don't know, just because of the community and societal oppression, then we must continue to suffer throughout our generations. So that's why people like Golsile are being told to wait until they're 40. But how do you know that the grandfather didn't die of cancer, or whoever was involved in a car accident in your home did not have a breast lump that had not been diagnosed just because they were Black and they were not allowed in the hospitals where only white doctors were working and where only white community were being treated? We gotta be fair. We gotta think about where we come from and really treat our patients fairly, especially Black and brown community. There has to be certain guidelines separate for Black and brown community. I am aware that colon cancer, they have made a certain clause for the Black African American community where they say African American community can screen at the age of 45. It's still way too late. It's still way too late. Yes, Boseman died at the age of 43. So, what are you telling me? He should have died before he had a colon cancer screening, or he should have waited until the symptoms were so severe that he was bleeding rectally before we screen. Are we not supposed to be screening patients just before they get the symptoms? Are we supposed to wait until people are very sick before we screen them? Is that not the role of treatment, where a person is sick, then you treat them? But screening means you find the population without disease and you detect the disease so that you can treat them early. Isn't that right? So when are we going to go to the Black communities and start screening them in time before they die? All of them are dying. Most of our Black and brown communities are dying of diseases that are preventable, that are curable, and sometimes that diseases that can be detected before they cause damage. So how long are we going to let this happen? How long are we going to let guidelines discriminate? Guidelines can discriminate, and sometimes I feel they are discriminating on some of the patients. I worked with the Black communities and I realized there was a huge discrimination. The first discrimination is the doctors that we see who are filled with so much racism and who are filled with so much judgmentalism and who don't speak the patient's languages, who interpret things their way. And when the patient comes, try to explain whatever is going on. Whatever is written in the chart is so completely different than what the patient is saying, just because sometimes there's that element amongst the doctors in cancer who just don't care. Literally, they behave as if they just don't care. They don't show patience, and at least the ones that I know, they don't show the patience for the community who are poor, community who are very sick, community who come with very advanced disease. There is just that notion that someone is going to die, someone should die. I just want to tell you, cancer should not kill you, especially the preventable cancers. There are cancers we cannot prevent, like brain tumors. We cannot prevent them. So many cancers can be prevented. Now, my question to you is, why are you dying of cancers that are preventable, detectable, and curable? Like cervical cancer is curable. Yes, cervical cancer is curable if detected early. Yes, you can detect cervical cancer way too early before it even becomes cancerous. You can detect it while it's still at the very normal level that can be removed. The cells will be removed. And I went through that. And when I was in medical school, I've shared on YouTube, find that YouTube where I was talking about cervical cancer, you will hear my story where I was also diagnosed with a CIN, which is a non malignant lesion for cervical cancer. And that was removed by a simple procedure called colposcopy. So basically, what I'm trying to emphasize to you today, there at home, as you watching right now, you gotta start standing up for yourself. You have to start knowing. You have to start choosing what you're watching. Watch the things that makes you live longer, and watch the things that save your life. Because if you do not, you're gonna fall into traps. You're gonna come very late in the hospital. You're gonna be stuck in long waiting periods, and you will die. You will die of preventable diseases and leave your children behind as orphaned just because you didn't know. There is no reason for you not to know. We are here and we are taking our time to share our knowledge with you so you can live longer. You can live longer. I can live longer if I have information and I use the information that is given to me. There is so much information. The world is like a platter, it's like a menu. You choose what you want to eat from the menu. Some of you choose to eat the shoes and the bags and forget about breast examination. That's your choice. You will find yourself dying of preventable diseases. Some of you chooses other things, some are choosing education, some are choosing other topics. But what is the blessing to know about your body, know your numbers, know your health, know your blood pressure, know your sugar level, know your weight? Some of us don't even know how much we're weighing, how much we're supposed to weigh, cannot even calculate the body mass index because you're depending on the doctor to be the one to clarify things for you. There is such simple information that you can learn on your own, master, and be able to save your life. Now, this is what I wrote. First of all, there was a celebration at ABC News, and they celebrating his death. And this is they were saying the title was ABC News Update Celebrating the Hero, and then it was saying Chadwick Boseman, groundbreaking impact and legacy. And this was my comment when they were showing his legacy. They were talking about his life, how he died of cancer. I said early cancer detection does save lives. Diagnosed at stage 3 is different than being diagnosed at stage 1. It's time to change the colon cancer guidelines that are filled with so much discrimination of the young and the elderly. It's now time to really look at our guidelines, doctors, and ask screening even at age 40. Black people don't know their family history. 35 years old is even way too late to start the screening. I had a patient who was 15 years old in my ward, and these are young girls who died in my hands. I believe that we need to something needs to change in our society. I then commented that if we still continue to bury the 15-year-olds with colon cancer, then do not give me awards. If you bury people like Chadwick Boseman and all young colon cancer patients who have lost their lives because of our guidelines, hindering them from screening, the screening that they deserve. Do not put me on your stage, magazines, TV stations, and tell me I'm a heroine for change when young black excellence die of preventable diseases. Doctors are now to blame. We are risking lives of many for just going with the flow. All these deaths are counted on our hands. All these boards we pay so much money to each year for them to sit and make such horrible guidelines. We implement them and don't even ask why. It's doctors who implement these guidelines. It's us doctors who refuse patients based on their age. It's us, not the people who sit and make those guidelines. But if we start asking the guideline makers to change the guidelines, there will be change. But the challenge is doctors are just like zombies accepting things as they are, even at the expense of damage that is taking place in our community. It is about time that we start speaking up and we start questioning some of these guidelines that how can you expect patients to screen at the age of 50? I just want to continue with the reading so that we take it even further. By the time you present with symptoms, it's already late. We want to catch you even before saving your life. Then we blame patients sometimes when we say, yet we tell them, go home and wait for cancer to rise, grow, kill them. When they come to us, we tell them it's not yet the time. Yet we tell them screen early. So it seems like our messages is mixed. We tell patients come early to us, and then when they come early, we tell them no, go home. You are too early. So which one is early? There's too early and there's early. It's confusing the community. What is it that we really want? This time patients are not wrong, but we doctors and policymakers are wrong, and we have let our community and patients down dismally. When we have to bury young people like this, for me, it's an embarrassment. It's an embarrassment to the health society, it's an embarrassment to the health leadership and the policymakers and researchers that we can bury 43 years old just before the year of screening, which is 50. I've seen young colon cancer patients die in my ward at the age of 15. I don't want to see you die of any detectable, preventable diseases. I don't want to see you suffering, not suffering from the curable cancers. I have seen elderly patients being denied of cancer treatment based on just their age, not their performance status. They were told by us, doctors, and gossip sometimes in our private meetings as having to die of something. We say in our meetings, oh, she has to die of something. When a 75-year-old comes and wants a screening and we refuse them, in our board meetings, there will be doctors will be saying, she has to die of something. Who are we as doctors to determine that someone must die of something? We've become very cruel to our own society. But then if I'm sick, you see how rules will change because I'm knowledgeable. And when I'm sick, I can motivate for myself. Then rules start changing. So that's not fair. We have to be able to check and screen patients. It doesn't matter how old they are, how old they are, how we think that age is frail. 75-year-olds are not that frail. Look at a 60-year-old and 80-year-olds. They're still performing. They are running shows. They are wearing high heels. We cannot judge people based on their age. I'm here to challenge. I'm here to challenge this guideline and here to stand up and say enough with death of our innocent people because of these guidelines telling us when we should screen. We should wait until age 50 to screen for colon cancer. Who wants to check if they have a disease at age 50? Honestly, by age 50, I'm almost that age. So who wants to start checking at that age if they have a disease or not? It's way too late. 50 is a lot of people are dying at 40s now. People are dying far earlier than the age that we expected to be screening. This is a screening. This is a checking if I have the disease. By the time you age 50, you will have a disease, obviously, most likely. Most likely. So many physicians, oncologists follow these guidelines without even questioning them. This is why we will continue to bury young, innocent excellence. We should have not lose Chadwick Boseman. This is what I believe. We should have not lost that young man. We should have not buried him because colon cancer with colonoscopy, you can detect it early. If he was diagnosed at stage 1, he would have had surgery, he would have had radiation and chemo and lived his life. Even better treatment than chemo that is available. So I believe we should not be losing people at that age just because of preventable cancers. If it was a cancer that we cannot prevent, we cannot easily detect, there are cancers that are complicated like pancreas. We still detect them. But if it was pancreas, I would say, okay, maybe it was lying under the stomach. We couldn't find it because it forms the stomach bed. Maybe that's why we couldn't find the pancreas. That's why they presented with advanced disease. But colon cancer, the screening. Let's give people the screening. And then I said, screening is so important, but what's more important is changing our guidelines that prevents the young from screening early. We are to blame for all these lives that are lost. The committee that sits and agree with these guidelines need to be dissolved and replaced by those who want to save lives. I want to thank the American Obstetrics and Gynecology Society for revising the cervical cancer screening guidelines, even without evidence, to recommendation of screening of young girls from age 21. They made changes based on the changes in our society and changes of disease profile and the changes where you can screen at the age of 21. So that is a huge change that we need to see with colon cancer. And I'm hoping that as we speak, more people speak out, we'll be able to influence the decision makers. But it's us who need to ask for these things. We need to show that we understand what's going on. We can see what is going on and we see the damages that the guidelines are causing and start making making an impact in our society in a positive light, in a light that's going to save our lives. And we need to stop maybe a little bit to being superficial and not and ignoring the most important thing, because that makes very few have a voice, because we don't pay attention to the things that matters, to the things that save our lives. We don't listen to information that is there to help us live longer. We want to listen to things that are more or less superficial, which is good because it's distressing. We love to do things that are more fun, but sometimes we got to think about our lives. Do you really want to live long in life? If you want to live long, then there are changes you need to make. You need to eat healthy. You need to start wearing your mask, social distance. Those are very important things. Start doing your screening. Start palpating your breast. We'll be doing a series of cancer awareness. This is a marathon that is starting now until the end of October, where I'm raising an awareness of cancer and speaking about the challenges, and opening your eye about the things that we see in our society. So some people were complimenting, like Zimasi Otiana said, "You are a treasure." I believe that a lot of doctors are really scared to speak the truth, and I don't know why. But I think we really need to start speaking the truth, because we're the people with the knowledge, power, and that power should be used to save people's lives, not just to gain power for ourselves. But the power should go beyond just to sit in that consulting room and treating patient. It should go to a level of implementing the guidelines and policies that are conducted and that controls our clinical practice. So somebody says Zaza Zah says, "This breaks my heart. My own father died from cancer 2 months ago." I'm so sorry to hear this. He was 75 years, but he was a strong man. With early detection, it could have been prevented. He knew he was sick. He went from one doctor to the next, one clinic to the next. But for some reason, no one saw cancer. No one picked it up. Some said it was TB, which is tuberculosis. The next one said it was pneumonia. I'm sure they would say COVID-19 as well, because now COVID-19 is an excuse for if it's the diagnosis for everyone with lung problem. So it's very easy to miss the cancer. I believe when they said TB is because of the picture that was shown on the x-ray. I believe that Zah, your dad, may have had metastasis to the lung. The metastasis to the lung may have seemed like tuberculosis from the eye that is trained to see the difference between TB on x ray and to see cancer metastasis on x-ray. So to medical students, please take the x-ray of the tuberculosis and then take the x-ray of metastasis and familiarize yourself with these, because you cannot be the doctor who misdiagnosed a patient. I don't know how embarrassed I will be when somebody is misdiagnosed by me just because I'm lacking knowledge of being able to read the scans. If you are not sure about what you're seeing, take a picture or take an image, send it to the nearest radiology center. Even if in your center there's no radiology clinic, because I know some rural communities don't have it, but pass by the specialist. It's better to refer than to say there's nothing. Refer and find out than saying there is nothing. I know some of us wants to push the line that, oh, I finished the line for the patients for the day. I'm done for the day. I'm done for the day. But what are you done? Are you done helping people, or are you done just ticking the line? You gotta think about the value of you being in that practice as a medical doctor. How many families are going to be crying because of you and your carelessness and your rush and your impatience and your cheating of your patients? It's just so unfair to people like Zah, whose father went from doctor to doctor, clinic to clinic, being told it's pneumonia and TB. How can we fail to diagnose cancer? How can we fail to diagnose something as simple as an elderly 75-year-old male? If a 75-year-old male come to you as a doctor, right from the beginning, you have to do a digital rectal examination or ask a question. Have you have a family history of cancer? How do we even forget this? His left lung had completely collapsed and the cancer had moved to the right lung. How did they not see, still see? It baffles me to this. I wish I could join a movement of some sort just to help. I'm not a doctor, but I want to be able to help where I can. I have the time. What can I do? I think when I responded to Zah, I was responding with so much shock and I just wanted to open up her eyes. But I think, Zah, we need to talk a lot more. If you want to do something, there's a lot that you can do. There's a lot in the community that you can play a role. We have a nonprofit and we do raise an awareness. Your story on its own can change lives. I would like to start with an interview with Zah and we start discussing these issues and I bring her on our live and we talk and we see what we can do. Sometimes you don't have to do a lot. Sometimes you just have to share. It is very important that we start speaking up and we share our stories. Don't be scared. Don't be scared what's going to people are very, very critical in our society. I apologize about the connection if I'm cutting off. It is very key that we pay attention to what people say and we learn from what people say so that we don't go and experience the same thing ourselves. So we had a conversation, me and Zah, which I will not go into details, but you can go to my Facebook page and find the conversation about this topic. And I also did a tribute on YouTube. You can find the interview on YouTube. And don't forget to subscribe on this channel so that when notification, press the red button and subscribe and like, comment, and share. Because only when you comment, you ask questions, I'll be able to assist and answer or get the specialist who can assist and answer your questions. And Avela Janga Kunene said, Kodwa doctor, I wish I could just give you a long hug. Your passion for people is amazing. And Mike is a young man who spoke too. He spoke about his also frustration. He said, my doctor told me I'm too young to have a BPH, which is benign prostatic hyperplasia. I told him, yes, maybe it's true according to your case studies, but let's do PSA just to be on the safe side. So this is someone who's a nurse who was very informed. His name is Mark Ogionke Totsetsi, who is based in South Africa. He advocated for himself. He said, Doctor, I do not care what your studies are saying. At the end of the day, I have the enlargement of my testicle, and I want you to be able to check what's wrong. Don't just say it's BPH. I want you to do a prostate exam. And don't feel bad when your PSA is negative or when your colonoscopy is negative. You've done it. You've got the baseline. The baseline is very key. They'll be working from something to say, at least in 2020, your baseline was negative. You have to just have a conversation with your doctor and let the doctor decide. So I have another comment that I would like to share. I wish, this is Tamago Haynes, says, I wish insurance companies, which is the middleman, can step away from healthcare system because they know zilch about health. Many things can be resolved early. When a practitioner takes health history, she or he is trying to create a frame of mind. If you have concerns, it can be addressed early than later. But to be told you don't qualify, yet you do a certain test, it is the insurance guideline more than it is a medically necessary. I always tell them it's either you pay now or you're going to pay more later. That's a very good point, because if we don't take care of ourselves and we don't take care of it now, things get worse later. You know, Tamago, I'm very happy about this comment that you make. Tamago Haynes lives in Brooklyn, in New York. And I'm so happy she made this comment, because I used to say to the Department of Health in South Africa back in 2003, we might as well screen my community, because treating with radiation is more expensive than when you have to go and pay a pap smear. Pap smear is about 40, 50, it was 50 Rand at that time. Now maybe it's about 200 Rand, which is about almost $20 to do a pap smear. And in Africa, it's about $20, $30 to do a pap smear. But then to treat, it's about $500, even more. So why do you want to pay $500 as the department? You should be going out on a full-blown screening of your community and detecting the cancers while it's early, and then you've removed the cells that are abnormal, and you save people's lives. People still continue to pay tax. Now people are dying, and then they're consuming the state funds even more by going for radiation and chemotherapy, which is far more expensive. CT scans, MRI scans. There's so much involved in the treatment of cancer, but it's so little involved in the screening of cancer. I just don't understand how we do things. I don't know whether it's about money, or I don't know whether it's about knowledge. I'm really confused at times, but I'm hoping that through this conversation we'll be able to find answers. It's the dialogue that needs to be started. It's the dialogue that needs to continue. We are passing the baton to those who are coming behind us, and we're hoping the future medical students will be future doctors who will question things and not just take things as they are. Ubuhle Phahla says, thank you, Thandeka Mazibuko. Your passion for patients and people is so amazing. I have no words. The word thank you is never enough. And thank you, Buhle. I appreciate that. We just have to do what we can to help each other. And then Mukandala Chileshi said, or Chileshe or Chileshi said, you're amazing. Very right. Early detection saves lives. Early screening is vital as well. And then we have Derek. Thank you, Mukandala. And then we have Derek Justin Barrel say, I agree with you, Dr. Justin is based in New York City. I agree with you, Dr. Thandeka Mazibuko. My best friend didn't know he had stage 4 prostate cancer until his bones were riddled with cancer. I always kept asking my own doctor from age 40 for checkups for prostate cancer. Thank God, no cancer, but enlarged prostate, where I am on the medicine that I mentioned, now changing from this medicine after the last dose that he had. The reason why I'm not mentioning the drugs is because we are not advertising medication here. We are just talking about the basics of how you can save your life. I don't want to advertise the drug companies that are not even supporting our screening of patients in this life or in my community. So we will not be mentioning drugs or mentioning anything about the drugs. Kamangu had made another comment, say Black people don't know anything about their family history, and those who recall it is very poor, period. They are ever not sure what killed who, which one first, because they often have multiple comorbidities and all are uncontrolled. This is such an important point, that we have multiple comorbidities. It means I have diabetes, hypertension. How do I know when I die which one is killing me if I'm dying at home without the doctor because I can't afford health care? or I am not allowed in the centers. These are our great great parents. They were not allowed in this hospital. And most of the time, they never met or remember the parents you are talking about. So some don't even know their parents. That is so deep. Some people don't even know their parents. Mm. And there's incarceration in this same history. It is done for a clinician to only rely on patient's recollection. That is now to only rely on family history to decline the patient of the treatment or the screening that they deserve. I've had patients who were injured by the same father I'm asking the family history about, and the boards who don't care about any one of us are delaying investigative procedure. I remember when I had to visit a fertility clinic 20 years ago, and they asked if I was a DES daughter, and I didn't know because my mother never discussed things like those with us. What birth control she used, she never told us if she was even on birth control. Who did in South Africa anyway? The doctor knew. Through that, she must have been using one because all siblings are almost the same number of years apart. It just told the doctor to assume I was one. Please share with your kids pertinent health information when they are old enough to comprehend. Parents, you must share. You don't need to wait until someone is sick. Share. Tamago is right. Thank you, Tamago Haynes, for this point. Please share with your kids pertinent health information when they are old enough to comprehend. It may save your life and their life too, so they can demand early screening if there's a history in the family. And Nomhle Mavi says, you're such a blessing. Only a few are like you. May you stay blessed always. Thank you all for your comments on the post that I made talking about when I heard about the death, which was like, I made this comment 5 days ago. And I thought I'd just share with you and go through the breakdown of this comment because a lot of people were really moved by it and they were sharing their own experiences. I'm hoping that these experiences have helped you and they will change your life and they will help you decide your own health needs and decide if you are being treated fairly and decide if it's the right time. If you age 50, you have not screened, you must be really not serious about your health. If you age 50, you have not done a colonoscopy, you have not done a pap smear, you have not done anything, please go and get it done. I know it's COVID 19, things are complicated, but it's very important that you take care of your health. I wish you a long life. I wish you safety. Discuss with your family. And this is Dr. Thandeka Mazibuko. And thank you for joining. And may God bless you. I'm tuning in with you based in New York City. I'm a South African. I care about your health and I wish you all the best. And thank you. Thank you.